Hi everyone, my name is Vicki Hayward. I am a nurse education consultant at the Washington Board of Nursing. I'd like to welcome you to our launch of the Washington State CRNA Student Nurse Resident Preceptor Grant, effective July 1st, 2024. In Gross Substitute Senate Bill 6286 has provided funding of $160,000 for 2024-2025 academic year for CRNA Preceptor Grant Program. The focus is on CRNAs who volunteer to precept anesthesia nursing student residents in healthcare settings. The goals of the grant program are to provide monetary incentive to precept, increase numbers of preceptors, increase clinical placement sites, as well as increase the CRNA Washington workforce. Who's eligible? You must be a Washington licensed and certified registered nurse anesthetist providing clinical preceptorship and precept nursing anesthesia student residents enrolled in an approved and accredited Washington public or not-for-profit school of nursing. These are the nursing preceptor requirements per the Washington Administrative Code 246-843-533. You must have an active, unencumbered state nursing license, at least 1 year of clinical or practice experience, precept nursing students at or above the level the student is preparing, must have orientation to written course objectives, student learning objectives, and role expectations before start of preceptorship, no conflict of interest that would impact duties to impartially supervise nursing students, and preceptors should be approved by their employer to precept students. What are eligible practice sites for student nurse clinicals? An eligible practice site is a clinical site that has been approved by the Washington State public or private not-for-profit nursing education program for student clinical practice. The nursing education program and the clinical facility must have a current affiliation agreement. What are the required completion hours for CRNA student nurse resident preceptors? You must meet the Washington Administrative Code 246-840-533 eligibility criteria, complete a minimum of 80 hours per year of clinical practice instruction. You may use multiple students to reach the required precepting hours, and you can tally preceptor hours throughout the academic year. What are qualifying precepting clinical hours? Direct patient care, which includes patient teaching. Precepting hours can be attained in various clinical settings such as perioperative services, pain clinic, ER, labor and delivery, and surgery centers to assist student anesthesia nursing students in obtaining clinical practice hours. Hours should be recorded in minimum increments of 30 minutes for the purpose of documentation of precepted hours. Call hours or standby hours do not count towards the minimum 80 hours per year requirement unless you are called in for direct patient care or patient education. This is the form that will be filled out by you when you have your student nurse resident with you. You will put the student name, the type of clinical setting you're precepting in, the date, and the amount of hours that you precepted. At the end, you will tally up the hours, and you may submit if it's more than 80 hours. 80 or greater, you will have the program director sign and date, and they will hand it back to you, and you will submit to our website with the verification application on the WABON preceptor website. What are the eligibility requirements? Out-of-state nursing school programs do not qualify for the incentive even if the clinical hours are completed in Washington State. Local, state, and federal government nursing employers should confirm that accepting the grant payment is not in violation of ethics laws. And there are laws here, Ethics for Municipal Officers, Ethics in Public Service Act, and supplementation of federal salary prohibition in the United States, Code 18 U.S.C. 209. How will the Board of Nursing pay preceptors? We will pay you either direct deposit to your checking or savings account, paper check sent in the U.S. mail. Payment will be issued at the end of the academic year once all applications are received. Grants will be equally divided by the number of submissions received and approved. These are potential grant amounts that might be given out depending upon the number of participants. We have $160,000. If there was 50 participants, there could be a potential of grant of $3,200. 75 participants, $2,133. 100 participants, a grant of $1,600. 150, $1,066. So we will divide the grant money of $160,000 among all participants that are qualified to receive the grant. This is your preceptor to-do list for the academic year 2024 to 2025. First step is you need to register for a statewide vendor number, and you register at the Office of Financial Management, ofm.wa.gov. You must have a personal statewide vendor number to submit for grant reimbursement. You cannot use a business vendor number or a DBA doing business as vendor number for the grant reimbursement. This is the website. When you go to ofmwa.gov, you go, I am looking for select statewide vendor payee services. And here is the link I am looking for. And then here is the statewide vendor payee services. I also have a direct link to the vendor page directly on our webpage. So this is what you will need: a vendor payee registration form, and I highly recommend using direct deposit authorization form. This way the money would be deposited directly into your account, and there's less chance of having a lost check. And here are where they are located. So when you're completing the statewide vendor number, there are two different options that you can do. I highly recommend using the DocuSign option, where you electronically submit your application for your personal statewide vendor. You will get it within 5 to 10 days approximately, or you can print out the form. And if you print out the form, you will need to hand sign it, and it's called a wet signature. And then you can scan or fax or mail the form back to OFM. But it's highly recommended first to do DocuSign, and then if you are going to scan it, please scan it to this email, payeeforms@ofm.wa.gov. This is what the registration form looks like, and I have highlighted two areas that I would want you to skip. Please skip question number 2 and question number 4. If you complete those ones, you will have a business or a DBA number, and we do not want you to have those numbers. We want you to have a personal vendor number. So to obtain a personal vendor number, you need to skip question 2 and question 4. And then at the end, you can either electronically sign it if you do it via DocuSign, or you can sign it via wet signature, and that would be with a pen, and then you would have to scan or email that back to OFM. Here is the website that has all the information that I just stated in the video. We have a link to the preceptor verification of hour form, and I also have the link to the preceptor hours reporting application that will be submitted through SurveyMonkey. Nika, my colleague, will have a short 5-minute video on how to apply via SurveyMonkey as a resource for you. and all submissions would be due by May 1st, 2025. This is the contact information for me and for my colleague Nika. If you have any questions, please do not hesitate to call us. We're happy to take care of any concerns that you have, and we're here for you. I hope that you apply for the grant program, and I look forward to interacting with you during the year. Have a great day. Take care now.